Dr. Christopher Hollowell, a board-certified urologist here in Fort Lauderdale, Florida. My practice revolves around minimally invasive prostate procedures, and I love these procedures because I'm able to afford the excellent results to my patients here in South Florida and around the world. I speak all over the world about minimally invasive procedures. And why I love this particular question is because most urologists, they only do one or two things. And so for them, that conversation is generally around a TURP, right, which is a surgical intervention. And there's variations thereof. We have aquablation, which uses water to resect the prostate, and we have laser therapies, which uses light to resect the prostate, but they're all TURPs really in different ways of removing tissue. What's interesting about when a patient comes to see me, a lot of times they actually seek me out because they've been told that they want to have a TURP by their other urologist, and they look online or they go through blogs or they'll read in some periodical and they'll find that there are other options out there. And these minimally invasive options, they're interested in what this can do for them. Now, the conversation that I have with patients is really quite simple. When you come to see me, first of all, it's not a one-size-fits-all. And I always love when all urologists, when I give a talk about, they'll say, well, if you could just do one procedure, which one would you do? And I say, wait a minute, that's not how this should be. This should be, you can provide the gamut of things to do. Now, I'm not saying I don't do TURPs, and I'm not saying I don't do aquablation, but they're for a particular patient subset. The vast majority of patients are amenable to minimally invasive procedures, so therefore, they're going to have that conversation from day one when they walk in the room with me. And what I love about minimally invasive procedures is that we can do a procedure on a patient that can actually offset their symptoms of BPH without minimal impact to their prostate and or to them. So there's quick recovery, there's very minimal long-term or short-term side effects, which is excellent for the patient. And they actually can recover back to normal activities within a short period of time. So I've always been interested in these procedures over my career, and over the last decade, we've had an explosion of really new and exciting procedures that have really addressed this BPH problem and have really been excellent at treating the problem and minimizing the side effects. And that's where Optilume comes in, a very exciting new procedure that I'm really happy to give to our patients here in South Florida. The value proposition for minimally invasive procedures is really simple. It is a front-end therapy. The AUA guidelines show that minimally invasive therapies, or MIST like people like to call them, are on the front line of therapy. So you don't have to ever go to medications. In fact, it didn't happen a long time ago, but in the last, let's say, 10 years or so, a lot of patients will seek me out saying, my doctor wanted me to go on these medications. I read about the side effects of these medications. I read about the long-term effects from these, and having to take a pill every single day. I never want to start with these medicines. And I always say that's okay, because now we have these procedures that we can offer you right away. So I'm getting that more and more as time goes on. But the most important thing is that these procedures, if done on the right patient, you can see surgical results without surgery. This is really amazing because when you look at that data, it's actually better than the other minimally invasive procedures. So the issue is that how is the Optilume going to affect this? Is that it is a balloon that inflates inside the prostate. And when you inflate the prostate, you're stretching the prostate open, opening up the prostate. But it's the secret sauce that's on the covering of the Optilume, that it's chemical that is transferred to the tissue with paclitaxel. So when we look at this data, it's quite amazing. These patients in the 5-year range, they are doing fantastic. And we hope that we will have data that extends beyond that, that will kind of show exactly the same thing. When Optilume first came to me, I was very intrigued with this. And why is because it's, again, going to be one of my most minimally invasive procedures. Essentially, we're just expanding the prostate and then adding a chemical to kind of finish off the job. And so why that is important is because now the Optilume can affect a bunch of different patients, and it can cross over into different, I began by saying that there are different types of prostates, but the vast majority of prostates who have lower urinary tract symptoms are going to be between 40 and 80 grams, and this is really the sweet spot for Optilume. If I can give them a procedure that's easily done, that has minimal downtime, that can give them superior measurables after the procedure itself without any short or long-term complications, I want to be able to give that to my patients. I would recommend Optilume to everyone, including physicians, right? So physicians, interesting enough, are not the most discernible people. So they know things are out there. And what I will say is that most of the times, the physicians don't really know a lot of what's going on, especially when you talk about internists or OBGYN or something like that. They're really seeking my advice, and it'll be vice versa, right? I don't really do what they do, and they don't do what I do. But what's interesting about that is that what I always think is that the nurses are the ones that know what's really going on, right? So when you talk to them, they are the ones, because they're the ones that actually spend the time talking to patients. They're the ones that end up caring for those patients after the procedures and seeing how they feel about certain things. So with physicians, they're not an outlier to me to recommend them, because I would do this to anyone who comes to me as long as they had a prostate that was amenable to the procedure itself.